Today we're going to be dissecting a fetal pig. And so we're going to start by cleaning up our area. So use a multi-purpose cleaner and wipe it down. We're going to put our safety PPE on. I have pretty long gloves, so I'm going to wear my gloves. Make sure they cover my watch. Here's my other gloves. And I have a long sleeve shirt that I'm wearing. And I'm going to get my dissecting tools out. So dissecting tools out. And I have my scissors, my scalpel, my maul probe, my forceps, and I have a pointer and the maul probe that came with the dissecting kit as well. So I've gotten the pig out and my dissecting tray. The dissecting tray you have in your kit is foam, but it works the same way. If you want, you can put like an old baking sheet or even like the top of a cardboard box for added protection underneath your dissecting tray. Most people have good experiences with the foam trays. Every once in a while, there's one that breaks. And so we're going to open up the bag and we're going to save this rubber band so that we're able to close the pig up and keep it tightly closed in between classes. We're going to be using this pig multiple times throughout the semester. So it's in an open bag and then a sealed bag. And so we're just going to take it out of the sealed bag. And I'm going to put the open bag over to the side so I can use it later. Okay, so we're going to open up the bag and you'll notice there's a lot of fluid in there, and that's just the liquid that stops them from breaking down. And so we have to be really careful to keep that liquid in places that are safe. So you can pour it in a sink or in a toilet. I would keep it out of your kitchen sink. The toilet's probably the best place to pour it. And when you do that, make sure you flush, or if you're putting it like in a utility sink, you run the water for a little while. So I'm going to go in and I'm going to take out the pig. Okay, and so just gonna let it drain in the bag a little bit and put it on my dissecting tray. And you'll notice it smells like a little mentholy, so you might want to have a window open. And so we'll just kind of look at the different parts of the pig. So we have, its head and its eyes. You can like kind of open its eyes a little bit, but you'll see there's a membrane that's covering the actual eyeball. There's already a cut in the pig, and that is where they injected latex into the veins and arteries. So when you open your pig up, you're going to notice that there's blue and red latex in the blood vessels. Okay, and you can see my pig lost its tail, and their little ears. And then over here we have the umbilical cord. And so we need to kind of open up this area. So the way that we do that is we're going to put yarn tied around the feet on both the fore and hind limbs, and that will kind of open up the area. Okay, so those of you who are knitters and sewers are at an advantage because you most likely know how to make a slip knot. So to make a slip knot, you put a loop around your fingers and put a loop through that loop, and then you pull. Okay, and so that is how you start the tie process. And you just kind of tighten that. I'm going to bring it down and around the tray, and so I'm going to set the pig up so that it is kind of pointing up so we can see all the stuff on the inside. And so you can leave this yarn on, but you will have to tighten it over time. I'm just going to leave this string over here like that, and I'll deal with it later. And now I'm going to do the same thing to the hind legs. So another slip knot, put it over the foot, tighten it up, bring it down and around the tray, and tie it around the other leg. Okay, so this is close to as tight, but not quite as tight as we're actually going to be working on it. I'm going to open up the pig, and I want to show you where we're going to do the cuts first. So there's this cut that was put in where they put the latex in, and we're going to bring that cut down to the center, and then we're also going to cut down here. So we're going to go straight down to the umbilical cord, and then we're going to go out around the umbilical cord out towards the hips. Let's see if a Sharpie will work here. So here, here, down, out, and out. You can almost see that. Okay, so when we're cutting, we need to be very careful, okay? Because, so there's the integument, there's the connective tissue, and then we start hitting organs. So you don't want to ever use the scalpel up and down. You always want to go this way, nice and light. You can cut with the scissors. You're just trying to get the uppermost layers. You can always cut more, but you can never uncut. Okay. I'm actually going to keep at this with the scissors because I'm having some good success. So. Okay, and notice I'm being really careful not to go too low. So there's some blood vessels right there that I want to try to keep intact. And so now I'm going to just do the skin that's above the rib cage. Okay, and I'm going to keep at this, kind of coming from this angle. And just like I mentioned last week, always cut away from yourself if at all possible. So I'm at the bottom of the rib cage, so I'm getting closer to the abdominal viscera, right, the organs down there. And so I'm going to actually hold the skin up more because really trying not to cut the organs down here. It is much more pleasant to work on a pig that does not have cut intestines. Okay, now I'm going to come in with the scalpel, and I'm just going to kind of go over and get down to the rib cage. Okay, I've actually cut through a little bit of the rib cage with this. Okay, now I'm going to carry out the cuts that go towards the hips. So again, lifting the skin, cut, 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 okay. And I can see that I'm doing a good job. I haven't actually cut any of the organs. This right here is actually the peritoneum. And I'm gonna cut just a little bit of that so it's a little bit more open. Okay, now I'm going to come from the other angle and I'm going to cut towards the other thigh. Okay, and again, doing my best to not cut the intestines. This is just the umbilical vessel that I cut here. Not a big deal. Okay, so pig's opening up. I'm now going to tighten the legs. So I have the lower part open, but what I really need is the upper part. So before I go any deeper, I'm going to kind of investigate. So I can feel the ribs right here, and I can see more of that parietal peritoneum here. And so I'm just going to very carefully cut under the peritoneum. And so now you can see the liver right here. The liver is really large in pigs and humans. Right here is where the diaphragm attaches. So I'm going to cut the diaphragm away from the wall. So again, just taking the scissors, staying as close to the wall as possible, and that's going to let me open things up a little bit more. Okay, and now I'm going to go up, and I just cut through the kind of the top of the sternum area. So that's probably the hardest cut you're going to have. And again, just take it easy, right? The more gentle you are, the more careful you are, the more interesting things you're going to be able to see. So the maul probe that came with your kit is a little bit sharper than I like the maul probes that I use. So you can do this. I do this a lot with my maul probe, but my maul probe is a more blunt instrument. So if you happen to have anything that's more blunt at your house, you might want to try that. And so I see a blood vessel here, and I'm just going to kind of take the maul probe so I can break the connective tissue up and get those blood vessels in view. Okay, so that is nice and open. Here's some more connective tissue. Okay, so now I'm going to cut on this side so that I can open up the thoracic cavity without doing too much damage to the organs. Okay, and cutting away the diaphragm, cutting away some pericardium. And you can see the inferior portion of the lung. And again, it's always a little bit harder to cut through the sternum and the clavicle. And come over here and see what I can clear out using my maul probe. You could also, since your maul probe is a little bit pointier than I'd like, you could actually use like one of the legs of the forceps. So I see a blood vessel there, and I'm trying not to cut through, but sometimes you have to, and that's okay. You know, fortunately, the pig is dead, so you can't make it any more dead. And we understand that this is your first time dissecting, and you're dissecting at home, so we're not expecting perfection here, but this is really nice. So I know that the smaller pig is, I think they're a little bit more disturbing than the larger pigs, but I actually think that you can see their organs better. And so I'm just going to kind of go through what I can see right now. So we have the thyroid and the thymus, We have some of the major blood vessels going up to the brain. We'll talk about those next week. I can see blood vessels going out towards the arm. Here's the heart surrounded by pericardium. So this right here is the fibrous pericardium. We have the lungs and the diaphragm, the liver. You can see the small intestine and the large intestine. And so we're more or less where we need to be. From here, we're going to open up the pericardium, and you can see the heart. And you might have to cut it, you might not. But you will have to cut away a little bit more bone. All the great vessels are right here though, so be very careful. See if you can keep all those great vessels attached. And I'm just going to grab a paper towel and kind of mop up on the inside. Okay, so whenever there's excess fluid, you can just kind of dry it off. If you have a very soupy pig, you can drain the pig. If you cut into the intestine, you can rinse it out, rinse the pig out, but you don't want to rinse it too much because then you start rinsing the fluid out. And so really doing a dry mop is a better approach. And I'm just going to put this in the bag that has the fluid that I'll be disposing of when I'm done. So when we learned about the heart last week, I said, you always want to anchor yourself with the pulmonary trunk. And so I am trying to find my pulmonary trunk. I think I might actually need a little bit more light for you to see this. But I can see the auricles, one here and one here. So there's the auricles of the heart. And the pulmonary trunk is always right between those auricles. So I can feel it more so than I can see it. I'm going to cut a little bit more of this pericardium away. But I'm staying away from the lungs. And while I know what the difference is between lung tissue and connective tissue, I totally understand that you do not know that difference. And so if you accidentally cut something that you're not supposed to, it's okay. All right, so we have a really nice pig here. I can see that interventricular sulcus. I can see the apex of the heart. Again, I can see the auricles of the heart. I will have to dig. I can see the inferior vena cava, but I still need to remove a little bit more pericardium. But right there's that inferior vena cava. I'm going to keep working up here. So I see the pulmonary trunk, and then I see just a hint of the aorta right here. And if I dry that area out just a little bit more, I can do the work that's needed to see the superior vena cava. And again, I'm just going to kind of keep trying to keep the lungs intact. And so, we have different tools, and so you're going to have to kind of learn about when you need them. So these forceps right now are very useful in removing excess pericardium so that I can get closer in to see the other blood vessels. And so there is quite a bit of tissue here, so it does take some time. Okay. And once you feel like you've done as much as you can with one tool, kind of just explore using another tool. And I don't know how much you can see, but I can see. So here's that pulmonary trunk, here's the aorta, and here's the superior vena cava. Okay, so that is as far as we're going to get this first week. The next time we take out the pigs, we're going to look at more of the blood vessels up in the neck and brachial region. And we'll go through all the systems over the course of the semester. When you're done with your pig, remove any matter that you don't want to have. And again, I always have a little trash bag next to my desk. My trash bag also has kind of an extra bag in there, so I can, like a little baggie, so I can close up any materials. I'm going to take the pig and I'm going to leave it tied because that will just make next time easier. Try to leave it tied. Okay, so this pig is pretty moist, so that's great. If you happen to have Lysol spray, I know how hard it is to get Lysol spray these days, but if you happen to have Lysol spray, that would be a great thing to do, just to spritz the pig a little bit. Barring that, you can just moisten a paper towel, and I'm actually using some of the fluid that was in the bag, just because I know it's embalming fluid, and so it will help keep things from desiccating. So I am putting the paper towel here over the cut surface so that it stays nice and moist. I'm going to put him on his side. I'm going to get the bag and put the pig in the bag. Okay. And just like with the heart, you want to take out as much air as possible. Twist it up and put the rubber band on. I'm going to take the pig and put it back in the dissecting box, or the box that the kit came with. That's where I will store it. I'm going to take my tools and my dissecting tray, and I'm going to clean those either in a utility sink, with a faucet outside, with a hose outside, bathroom sink. I would keep it away from your kitchen sink if at all possible. I'm going to remove any solid waste that's developed while we were working, and put that in my little plastic bag by my desk. And still wearing my gloves, I'm going to clean my workspace. Now that my workspace is cleaned and everything that I've used while I was dissecting is clean, I'm going to take off my gloves, right? So grab the edge, take it off, grab the other edge, take it off. We're gonna put it in the trash, and we are done for the day.